Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Cardiovascular. And I am so thrilled today to be joined by the amazing Dr. Ellie Campbell. Now, Dr. Campbell, I met her late last year as an introduction through a mutual colleague of ours, and she just wowed me with the depth of information that she has around cardiovascular disease and the leading causes that are really, really missed when it comes to Western, and even I would say in my field, in the natural alternative medicine, a lot of people aren't looking at what some of these major drivers are. So Dr. Campbell, she is a family physician. She's been board certified for well over 30 years. She's also double certified in integrative medicine. I think that's been for about 8 years, right, Dr. Campbell?
Right.
She's one of the original functional medicine children from about 15 years plus. So she's been doing it for a very, very long time. She's had a special interest in things like bioidentical hormones, helping with fertility and menopause, thyroid disease. But really, and I'll get her to share the story, she had a really interesting journey that led her down the pathway and discovery of cardiovascular disease and what really drives that, and how she could be a really better physician for her patients, which is also a really beautiful story of how she's got to where she is. She's also writing a book, The Blood Pressure Blueprint, which will be out in June, but we'll talk a bit about that later. And I'm so excited because I think it's going to just give doctors and patients some really good information so they can advocate for themselves. So Dr. Campbell, thank you so much for joining us. I'm so grateful to have you here.
You're so welcome. It's my honor and pleasure to be with you today.
So really, when we caught up last time, you just have such an amazing take on what drives cardiovascular disease, to the point, you know, where I've been in functional and integrative medicine and been a naturopath for, again, like you, well, 25 plus years. And a lot of the drivers that you talk about are touched on, but not really spoken to the degree that you have, where you've really found that they are some really big drivers. And the story you shared right before we hit record, I'd love you just to tell people how you got into this, because I also find that is such a testament to the character of who you are. So what led you to cardiovascular disease and all of that stuff?
Yeah, so, you know, I'm a primary care family doctor. My mission in life has always been to take care of families and to help folks out however they needed it, and to prevent disease wherever it's preventable. And so along that journey, I met this family, and the daughter came to see me when she was unable to get pregnant. And so at 42, we were able to successfully help her get pregnant and have her second child. And through that journey, I got the daughter, the husband, the 2 kids as my patient, and the grandmother became my patient as well. Now, Dee was just delightful. She was the matriarch of her family. She helped run the family business. She kept the books. She was one of my bioidentical hormone replacement therapy patients, because she needed hormones to help keep up with her much younger boyfriend, so she could go line dancing with him on the weekends and still ride 4-wheelers with the grandchildren. Right.
I love
so
it.
She was just delightful. Now, she had high blood pressure, which we managed. She had high cholesterol, which we managed. And I thought everything was going along swimmingly, until one day her daughter called me and said, "There's been a tragedy. Mom didn't come in for work today." I went down to her house, knocked on every door, looked through every window, and I found her on the floor in her basement office, collapsed. I called 911. She's had a massive stroke. She's paralyzed on one side, and she's alive, but she's going to be going to the ICU. So she went to the ICU, and she joked that this was going to be a long and hard recovery, a lot of rehab, because it's really hard to line dance with only one good leg. So she kept her sense of humor through the whole thing. But then she had a tragic complication. While she was in rehab trying to get over this stroke, that weak spot in her brain blood vessel that had that initial stroke broke loose, and she developed a brain hemorrhage, and she passed away. Oh, no. And I felt like I had been punched in the gut, because I followed the best evidence-based guidelines, all the things my family practice experts and industry experts told me to do. And I kept her blood pressure to target, and I kept her cholesterol to target, and we took care of all the root causes that I knew about, but somehow I had missed something. And I spent the next 3 years of my life studying everything that I could about heart attack and stroke prevention because I didn't want that to happen to anybody else that I cared about in my practice. And the piece that I missed that I now know was so critical was that in the weeks before her event, Dee developed a toothache. She developed an abscess in one of her teeth, and those bacteria, almost certainly based on what I know now, were the trigger that caused the plaque rupture that led to that initial stroke. And so I now believe that if we understand the oral and systemic connections, that we can prevent the #1 cause of death in our country, which is cardiovascular disease. So in my opinion, heart attacks are optional, strokes are stoppable, and dialysis is not your destiny if you understand the triggering causes and correct them, and you're willing to do the work to change those outcomes, right? And so you need a guide to help you do that, someone who understands these connections. And so now this later half of my career is now dedicated to teaching younger doctors, younger naturopaths, nurse practitioners, and dentists and dental hygienists these interconnections, because no cardiovascular prevention team is complete without a dentist and a hygienist on the program. And that's where my journey has taken me. And that's what I'm hoping to share with your audience today is some of those oral and systemic connections.
Yeah, amazing. And again, just a testament to who you are as a person. So I guess this is a bit of a legacy for Dee, right? So we'll do that.
It is, absolutely.
And look at all the people she gets to help, right? So
exactly.
So let's dive in. So let's talk about this oral hygiene. And of course, people listening are going to have kidney disease, but as we know, cardiovascular disease is the second leading cause of kidney disease and changes in kidney function. And sometimes we have patients where you can do everything left, right, and center, and you can't quite get the blood pressure where it needs to be. Or it sounds like if you're not really treating this driver, you're still going to have changes in blood vessel health and endothelial health. So let's dive in. Walk me through this.
So I think that if we go back and we think to ourselves, what are the underlying root causes that lead to the blood vessel dysfunction that is probably at the root cause of all three: heart attack, stroke, kidney failure, right? It's about the blood vessels. And what leads to that blood vessel dysfunction is really two things. It's oxidative stress and it's inflammation. And if we're not finding the root causes of those oxidative stressors or that inflammatory trigger, then we're not going to get all of those things removed. You know, in functional medicine, we have a thumbtack rule. We say, if you're sitting on a thumbtack, it takes a lot of Tylenol and morphine to make that thumbtack feel better. And if you're sitting on 2 thumbtacks, removing one really didn't make your problem 50% better. So this is what happens with oxidative stress and inflammation. We might remove 2 or 3 or 4 of those causes, but if there's one remaining that we've missed, like I did in D, I missed that one thing, then the events can happen. But if we find them all and relieve them all, then longevity is our next step, right? We're going to have a long and healthy life without those complications, without time in the hospital for heart attack, stroke, and without needing to go onto dialysis. So some of those root causes, many of them are connected to the mouth. So we start by looking at the mouth structure. Like, who would have thought that the shape of your face and your mouth are connected to your blood pressure in any possible way? But first of all, we'll talk about a tongue tie or a tongue tether. So many people are unable to put the tongue on the roof of their mouth. And that's the happy resting position of the tongue. It should sit in the roof of your mouth, not in the floor of your mouth while you're sleeping. And if your tongue is tethered to the floor of your mouth, you can't ever get it up in its healthy place. You tend to live in sympathetic overdrive. You don't stimulate your vagus nerve the way that you should. We need to get that vagal stimulation going by having the tongue up where it belongs. And so simply asking your patient to stick out their tongue and put their tongue on the roof of their mouth can be a very simple intervention that you go, oh my goodness, we need to get you to a functional dentist or a myofunctional therapist, which is like a physical therapist for the mouth, lips, and tongue, and get that tongue retrained to sit in the correct position. So that's one simple example.
Wow.
right?
So
Another one.
simple.
Yeah,
Yeah.
it's so simple and yet so overlooked. Another thing, you tip their chin up and look at their nostrils. Are their nostrils symmetrical? Because if they're not, and if they rapidly breathe in and one side sucks in and the other does not, there's obstruction there. Why is that important? Well, we have this miracle molecule called nitric oxide. You might have heard of it. It's
Love
so
it.
important. It won the Nobel Prize, right?
Mhm.
This is a gaseous signaling molecule. It's one of the few gases that has many downstream effects, and it dilates blood vessels. In fact, it was this research in dilating blood vessels. They were trying to invent a drug that did this nitric oxide pathway, trying to invent a drug to treat blood pressure. Because if your blood vessels are too constricted and your heart is choking against every single heartbeat, your blood pressure is going to go up. But if we can dilate those blood vessels, your blood pressure is lower. They invented this blood pressure drug. It was terrible at controlling blood pressure. But all the men came in and said, ooh, guess what? My erectile function is so much better. And they labeled that new blood pressure drug Viagra. And they never sold it for high blood pressure, but you know what they did sell it for? Erectile function. And it works through the nitric oxide pathway. Well, where is nitric oxide made? It's made in endothelium. It's made in lots of places, but the primary place it's made is in the floor of the nose.
Really?
So if you are not breathing through your nose, you will not have optimal nitric oxide levels.
Hence
If
why
you have
no good.
Being a mouth breather is no good. And if you suck in and you have obstruction on one side, and I look at your nose and you got one big nostril and one little itty bitty nostril, I know you have nasal obstruction. I know you're not nasal breathing well at night. I know you're not making nitric oxide, and you have all these downstream effects. So I send you for a CAT scan or to the ears, nose, and throat doctor, and we talk about maybe some sinus surgery or nasal airway remodeling. We teach you how to breathe through your mouth, and all of a sudden your blood pressure drops 20 points because we got this obstruction corrected and your nitric oxide levels where they need to be. So that's just two things by looking at your face.
Yeah, it's crazy, right? And just so simple. And I mean, I know how many people mouth breathe. Like, it's James Nestor made that great book, Breathe, and just went right through that in detail of why that's so important. But I didn't know about the nitric oxide being produced through the nasal cavity.
Yeah. And the rate limiting step in nitric oxide synthesis. In other words, if this one is slow, everything else is slow. That's what rate limiting means. The rate limiting step is nitric oxide synthase. That's an enzyme that tells your cells to make nitric oxide. It's mostly made by bacteria that live on your tongue.
Right. Okay. So walk me through that then. If
so
you've got...
guess what? If you don't have healthy mouth bacteria, you don't have enough nitric oxide synthase, and you can breathe through your nose all day long, but you're not going to make good nitric oxide. So we need to have good, healthy, friendly mouth flora. We are not supposed to have a sterile mouth. We need bacteria. They need us and we need them. We're an ecosystem living together, right? A plant has more genes than I do. I only have 25,000 genes. A plant has 130,000. How come I only have 25,000 genes in my entire human genome? Because I borrow the benefits of all the bacteria that live inside and upon me, right? So I have to borrow the benefits of those mouth bacteria to make my nitric oxide. And if my mouth bacteria is out of balance because I tried to sterilize it by using Listerine or other mouthwashes,
read my mind.
I will lower my nitric oxide synthase levels. I'll lower my nitric oxide amount, and I will raise my blood pressure on average 6 points by using mouthwash. Stop using the wrong kind of mouthwash.
Yeah, no, this one we have been taught as naturopaths. Mouthwash is bad. That one is finally hitting at least our training, but that's so 6 points. That's crazy just from mouthwash.
just from
And if you've
mouthwash.
got a proclivity to kidney disease and your blood pressure is going up, it's such a simple intervention, isn't it?
So simple and easy. And really, we need to get to the dentist because, but I take that back. We need to get to our enlightened dentist because just like in the world of integrative medicine, conventional doctors have not caught on to this. In the world of naturopathic medicine, even many naturopathic doctors don't understand some of these things. They have to be enlightened to know what to look for, to know what tests to order, to know how to take that patient to that next step. So, for example, one of the tests that I run regularly is an advanced inflammation panel. We've nicknamed it the FIRE panel. Cleveland Heart Labs does this. Cardio IQ from Quest Labs does this. Boston Heart Diagnostics does this. There's many labs now doing these advanced inflammation panels. And they include some of the following markers: high sensitivity C-reactive protein, oxidized LDL, F2 isoprostane, myeloperoxidase, and LPPLA2. So LP, that's a lipoprotein, lipoprotein associated lipoprotein lipase. So it's an enzyme made by white blood cells when they're angry.
Right. Okay.
Those blood vessels, or those blood cells, when they're angry in the artery wall, we have to remember, how do we make plaque? How do we make plaque? What is plaque, right? Well, we have two kinds of plaque. We have plaque on our teeth. We have plaque in our blood vessels. Plaque in the blood vessels begin to make the blood vessels smaller so that more force is required with every heartbeat. Obviously, that's going to raise your blood pressure and increase your risk for events. Most of the plaque is formed behind the drywall, in the wall of the muscle of the artery, not where the blood flows. It's in the wall of the artery. 90% forms there. And then a plaque will rupture, cause a little blip of cholesterol to get in the bloodstream. The body doesn't like it. It aggressively forms a blood clot over the surface of that cholesterol oozing into the bloodstream. The blood clot is what causes the sudden event. If it's a small enough blood clot, it's going to seal off that oozing cholesterol like a scab. Smooth muscle cells are going to infiltrate, calcium's going to infiltrate, and you'll get a little speed bump in the blood vessel that can be seen on an ultrasound test or on an angiogram as a plaque. If the blood vessel, if the blood clot is large enough, it will actually occlude the vessel, causing a sudden event, such as D-stroke or a heart attack. If you can get to the hospital quickly enough, and you have the right kind of stroke or heart attack, they can give you clot busting drugs to burst open that blood clot and restore blood flow. And that can be a miracle, magic eraser to stop that event. Not every stroke and heart attack is eligible, but this is why we need to call 911 and get to the emergency facility as quickly as possible in the hopes of saving whatever organ was damaged. But the plaque is often formed by this corrupted cholesterol getting behind the drywall. One of the bacteria that live in your mouth, called Porphyromonas gingivalis, it's an ugly bacteria. It's very mean. It makes all kinds of gene transfers to the other bacteria, sends signals to all the other guys to tell it to make a bloody mess out of your gums. It causes periodontal disease or gum disease. Part of the reason why it makes all these signals to make a bloody mess out of your gums is because it eats blood as one of its favorite food. It's a nasty bacteria. It wants to make sure it has plenty of fuel. Once it gets enough blood around, it now buries itself inside the red blood cells and can travel anywhere in the body wherever the blood cells go. Now you have Porphyromonas gingivalis mouth bacteria in your brain, in your arteries, in your kidneys, in your pancreas. Once it gets there, it has a nasty habit of secreting this goo called phosphorylated dihydroceramide. Phosphorylated dihydroceramide is a gooey cholesterol-like plaque. It makes its own plaque wherever it lands. It can make plaque in your brain, leading to Alzheimer's. It can make plaque in your carotid, leading to plaque there. It can make plaque in your coronary arteries. And it can even trigger this plaque rupture that leads to events. So I want to know if I have PG, Porphyromonas gingivalis, living in my mouth.
Yeah.
Because if I do, I want to go straight to my enlightened dentist and hygienist who will have a protocol to eradicate that bacteria out of my mouth. How will I know if I have it? Well, if I have a bloody mess in my mouth because I'm brushing and flossing and there's pink in the sink, there's a really good chance that I have it.
Okay.
So I'm going to march to my enlightened practitioner, and I'm going to ask for a salivary diagnostic test, a spit test, to look for these so-called red complex mouth bacteria. And if they find it, it's a DNA test, it comes back in a few days. If we find that you have any of these, and Porphyromonas gingivalis has other friends called AA, TD, TF, and FN, and they all live together in this ugly, bloody mouth colony. They're not good. They don't play nicely together. They play nicely for them, but not to the rest of our mouth bacteria. And the stronger that our friendly mouth bacteria are, the less of a chance that those guys have of setting up housekeeping. So how do we make our mouth environment healthy, right?
Yep, that was my question.
Well, first of all, it comes down to our fundamentals. We have to eat clean food. We need nutrition. We have to have nutrient-dense, antioxidant food that provides nutrition for our healthy mouth cells and our healthy bacteria cells. We have to have the right pH in our mouth. If our mouth is too acidic, that highly favors the ugly bacteria and disfavors our friendly bacteria. Well, I don't drink acid. Who drinks acid? Many of us do. Coffee is one of the most acidic things that we can drink. There are some more alkaline coffees, and they're coming out on the market, and I would encourage people to look at them. And just drink your coffee all in one sitting. Don't sip the cup all day long. Don't carry that 32-ounce coffee and sip it for 4 hours, because that's acid after acid after acid. If your pH in your mouth is below 5.5, you're going to start to dissolve the enamel. But you can handle a 15-minute dip in your pH, and your body will recover and make enzymes that neutralize that and bring the pH right back to 7 pretty quickly. But not if you keep deluging it with acid. Many bottled waters, including Dasani, are down in the pH around 3. So if you're sipping your Dasani water all day long, you are more at risk for changing your mouth bacteria. So I'm generally not a fan of bottled water in general, because I don't like the plastics in our environment, and I don't think we need to have perfectly good water put in a bottle so that we can, for our convenience, carry it. Filter your own water, fill up your own bottle and reuse it. That's my preference. But if you're going to drink bottled water, please go online and check what its pH is, and make sure that it's in the neutral range, at least 7, 7.4, 7.5, maybe a little above that. So don't drink acid. And mamas who have babies, apple juice is equally acidic to coffee. So apple juice will rot your baby's teeth because it changes the pH. If you want your baby to have apple juice, give them a sip of apple juice and let them have it, but don't let them sip on it all day long in a sippy cup. It's bad for their pH. So we've talked about pH. Mouth breathing lowers your pH. Dries out the oral cavity, enhances the ugly bacteria. So we don't want to be mouth breathing, especially at night. We want to eat clean food. We don't want to rinse with acid. Things like, what about apple cider vinegar? How many people have started their day with a lovely glass of water with apple cider vinegar? That's very acidic. So drink it all in one sip. Get it all down. Don't sip it all morning long. It's not something you should drink like that. It's a one-shot deal.
Yeah. Okay.
Okay. So if I discover Porphyromonas gingivalis in my mouth, I want to get to an enlightened dentist for a protocol to help eradicate that. And part of that is almost certainly going to be a deep cleaning. We call this root scaling and planing, and it's a very deep cleaning, usually 1 or 2 quadrants at a time. It causes some inflammation and gum bleeding. It can be unpleasant to have that done, but it's a necessary part of breaking up the biofilm and getting rid of the bad bacteria. Then we have to work on the host immunomodulation. I have to not be so reactive to that bloody mess. I need to calm my immune system down. That means all the therapeutic lifestyle things that we all know to do. We have to sleep 8 hours restfully every night. We have to spend time daily in gratitude and prayer and meditation to get our sympathetic nervous system out of fight or flight, get it down into rest and digest. We have to make sure that we're not backwashing acid from our stomachs up into the back of our throat every day. That acid reflux can be terrible for our mouth bacteria. So talk to your naturopathic or your enlightened primary care doctor about a way to treat and restore your gut health and get rid of that acid reflux. And I don't mean taking that purple pill every day. That's not the solution for this, right? We want to make sure that we have good quality sleep. Sleep apnea is a hugely underdiagnosed and underappreciated trigger for high blood pressure, cardiovascular disease, kidney disease, and stroke. So it leads to oxidative stress. It leads to inflammation. It leads to spiking cortisol levels that can burn our body out over time. So we don't want sleep apnea. Not everybody that snores has sleep apnea.
No.
Not everybody that has sleep apnea snores.
Yeah.
So we have to have a very high level of suspicion that the patient may be suffering. Ask them questions. Do you wake up rested and refreshed in the morning? How likely is it that you'll fall asleep sitting at a stoplight? How likely is it you'll fall asleep watching TV or reading a book at the end of the day? How fatigued are you? Does it feel like you run your life by walking through molasses? Right? If you're fighting through it and doing your day, but you're so overwhelmingly fatigued, get an evaluation for sleep apnea. It can save your life and it can prevent a devastating heart attack, stroke, or the need for dialysis.
Yeah, all really good points. And it's so fascinating because there aren't very many practitioners out there that I think will do those simple checks, like you say, like looking at the nose and checking if people mouth or nose breathe, or are you using Listerine, and all those sort of things. So
right. So these are all things that I've written in my book, which I hope to have come out this summer. It's called The Blood Pressure Blueprint, and I want to empower patients. It's written for patients, not for the practitioner. And the point is, the more empowered we as a population are, the more enlightened we are with information, the better we can choose our practitioners, and we can drive them to get to the education that they need to take care of us better.
Yeah.
Right? Because if one patient comes to my office and asks me about Viagra and I've never heard of it before, I'll probably blow them off. If 2 patients come in and ask, I'll blow them off. But if 15 patients in a week ask me about this same thing, I'm now curious enough as a practitioner that I need to go learn about it. And that might mean going to a medical conference or doing an online training, or somehow finding a way to provide the patients with information about the things that they're seeking, especially when it's a simple intervention that their insurance may pay for and there's treatment for that's covered on their insurance plan. Now, one thing I wanted to make a point about sleep apnea. Many patients are reluctant to do a sleep study because they believe that they are so claustrophobic, they could never wear a CPAP mask.
Gotcha.
right? And so they say, I won't do the test. I'm just not going to do it because I won't do the treatment. I just know it. I would smother. It scares me. I can't do it. They don't know that there's other treatments for sleep apnea besides CPAP. And I'll tell you two of them. The first one is super simple. It's positioning. It's if we do the sleep test and we find out that you only have apnea when you lay on your back, we find a way to not let you lie on your back, right? And that's one way is a little backpack with an inflatable ballast that you put on after your pajamas. You blow up the little pillow and you can't roll onto your back because there's a pillow in the way, but it's in a backpack. So you can sleep on your side and it won't bother you. But as soon as you try to lay on your back, it will be impossible. We can use, there's certain types of positioning pillows we can use, but it's simple positioning. Also, many people with mild sleep apnea can get away with mouth taping. Mouth taping is a thing. I love my mouth tape. I will not travel without my mouth tape. I will not sleep without my mouth tape. I love my mouth tape. I unfortunately grew up in a day and age when it was standard practice for us to remove 4 teeth and put us in headgear for orthodonture. So they pulled 4 perfectly healthy teeth. I had an overbite. They put me in this headgear that I wore that smushed my whole face backwards. And that was a beautiful way to get me straight teeth. And I was very happy to have a pretty smile. What I didn't know was they removed 15 millimeters of space for my tongue, pretty well guaranteeing that my mouth would be too small. And later in life, if I gained any weight at all, which we mostly do, then I didn't have enough room for my tongue. And I developed sleep apnea as an adult because of the treatment that I'd had as a teenager. So now I am wearing, my second solution is as an oral appliance. My dentist, my enlightened dentist, has fitted me with a dental appliance that has a little key. And about every 5 days, I turn the key and it cranks open. It's literally growing me a larger jaw. Both my lower jaw and my upper jaw are becoming larger. So now I have room for my tongue. It sits in the roof of my mouth and I tape my lips closed at night. I no longer snore. I no longer have sleep apnea and I don't have to wear a CPAP mask.
Yeah, I do know about that. And that's something I've heard of that can be really effective. I'm lucky. I grew up, my parents used to tape mouth tape when we were kids. So we got really hardcore trained. They're like, you will never breathe through your mouth, tape, tape, tape. So, and I am a chronic now nose breather, which has been handy. So I know how important it is. It's super important.
So if all parents were so enlightened, then we would have much less problem with our children going forward, because sleep apnea in children can cause bedwetting, ADHD, daytime fatigue, poor grades in school. And all we have to do is tape their mouth closed at night and they get a good night's sleep. It takes a little while to learn how to breathe through your nose. But once you do that efficiently, it's a blessing for the rest of your life.
Yeah, game changer. So is there anything else you want to add about the bacteria and the link between the oral cavity and cardiovascular disease?
Yeah, just one other thing, and that is that we now know that these certain strains of mouth bacteria can literally cause cardiovascular disease, 3 distinct mechanisms. They've been very well outlined in the scientific literature, and they literally raise your cholesterol, make your endothelium leaky, and allow the bacteria and the plaque from cholesterol, corrupted cholesterol, get down there into the arteries, and they change the way the smooth muscle cells are matured to cause this plaque. So these mouth bacteria, we think they're confined to the mouth. They're not. They go everywhere in our body, and wherever our blood goes, these mouth bacteria can go and wreak havoc. So by getting a mouth spit test to find these bacteria, track and monitor them over time, is a life-saving strategy. And at this moment in time, I do not know any insurance that pays for this mouth bacteria test. So it's an out-of-pocket test. Depending on which company you use, it could run from as little as $75 to as much as $200 or $300, depending on how many bacteria you want to check for and how often you want to do it. But I think it's something, number one, if I have the opportunity to talk to the insurer people about the importance of this and why it should become a covered test, and that will make it more available to more people. But meanwhile, if you only did for your car or your house what your car insurance or your house insurance paid for, what would your car look like? What would your home look like? So instead, we need to invest in ourselves. And I think this spit bacteria test is one of the most important health investments that one can make, especially if you're at risk for heart attack, stroke, or kidney disease.
And how often would you recommend having it done if you were being on the preventative side?
Yeah, in a perfect world, probably 2 to 3 times a year.
Okay. And that means that the mouth bacteria can change that quickly, I guess, then too.
They can. However, if you are, once you've established a very healthy mouth bacteria and an oral hygiene routine that is healthy, then we can probably reduce that testing to once every 1 to 2 years, because it stabilizes to a new healthy flora. And if I have 3 or 4 tests a couple of years in a row that are normal, then we can. Now, I did have a staff member I was doing this on, and all of a sudden her mouth bacteria totally changed. And I went into her and I said, "Who have you been kissing? What are you doing?" And she got all red in the face. And she goes, "I have a new boyfriend." And I was like, "Well, it showed up in your mouth bacteria."
Really? So there is an oral transfer of bacteria.
They're contagious. Yes, they are.
Okay. Okay. That's good to know. So that's an event that will obviously rapidly change your mouth bacteria.
Correct. So we might be checking every year, but if you have a new partner in your life, we might want to do a little more often.
Fascinating. Okay. Wow. All right, Dr. Campbell, is there anything else? I just find all of this fascinating, and I just find it such a big link when we have patients where we can't get them well, or we don't know why they're, not progressing like they should. And this seems to me, that most practitioners are scared of the mouth. We leave that for the dentist, but the dentists really need our guidance maybe to start working with all of that sort of stuff. So we need to
develop a language to understand each other, right? So we as primary care providers need a little bit of extra education in the oral anatomy. What do we call that thing when we see it? Maybe in traditional Chinese medicine tongue diagnosis, we could take a little training in that, because that might help us better help our patients. Maybe we need to learn these 5 red complex mouth bacteria so that we know how dangerous they are. And they're not only associated with cardiovascular disease, but cancer, with metabolic syndrome, with arthritis, with Alzheimer's disease, and with pregnancy loss. So prenatally, moms should be having this test to be sure that their mouths are healthy, because like I said, once those blood bacteria get in your bloodstream, they go everywhere your blood flows. And if you're growing a baby, they can end up there too. So we do not want periodontal disease in a pregnant mom. We want to make sure that her mouth is as healthy so her pregnancy can be healthy too. So by learning each other's language and the downstream effects that these mouth bacteria can have, we now have tools to identify who has these bacteria, and we can make a strategy to eradicate them.
Yeah, right. Well, I find it also fascinating. So a couple of key tips that I took away from is get rid of your coffee. It's too acidic.
Or drink it all in one sitting quickly and not sip on it all day.
Check away the Listerine.
Yep.
Yeah. And then obviously whole foods, great diet, things like all the stuff that we know to nurture the host and make sure that we're living our best healthy lives. And then just doing simple things, get someone to check your nose or cavities. Is one nostril bigger than the other? And do this spit test. The other big, most important thing is to know you really need to do a spit test. And if you just do it once to figure out where your baseline is, and then you can make some really good decisions from there of like, oh, maybe this is contributing to my cardiovascular disease and high blood pressure. I need to go down this route. It's not one I've looked at yet. So yeah, that all makes sense. Fascinating. Well, I really, really appreciate your time. As Dr. Campbell mentioned, she's got a book coming out, The Blood Pressure Blueprint. As soon as it is published, we will let you all know and let you know the details of that. I'll also put Dr. Campbell's, you've got a website there, I think I remember looking at. So I'll put her link below if you want to get in contact with her. If you're in, do you work only one-on-one, or do you work via telehealth and Zoom and
my license here in Georgia, I'm in suburban Atlanta. I have to see patients face-to-face once a year. After that, we can do remote telemedicine, but I have to see you in person once.
Well, if you want an amazing integrative functional practitioner that really thinks outside the box, now I'm talking really thinks outside the box, and I can't recommend Dr. Ellie Campbell enough. And as you can tell from her story with Dee, she really loves and cares for her patients. It is her driver to make sure she really treats you as a person, not a disease, and really gets to the root cause. And she has the brain and wisdom to think outside the box that most people get scared to do, which is such a beautiful gift. And we're going to have her back because this is just one aspect of all the things that can drive cardiovascular disease. So we're really going to do a deep dive with really one of the leading experts in the field at the moment of just what contributes to cardiovascular disease, and we will really cover that in a lot of detail that not a lot of other people are looking at. So we'll hope that you'll join us again. So make sure you hit subscribe. That way you'll get notified when Dr. Campbell comes back and joins us. Make sure you hit like. That helps the old YouTube algorithms. If you want to know more about what we do, head to www.kidneycoach.com. We're also putting up information every day on our Facebook. We did write a thing about, after I spoke to Dr. Campbell, I said to one of my writers, go and look up this bacteria and write me a blog post. So you'll find there's some information on our website about it and also on our Facebook page. Thank you for being part of our audience. And Dr. Campbell, thank you again for your wisdom, your time, and pioneering the way in just helping people live better, healthier lives.
You're so welcome. It's my honor.
All right, everybody. We'll see you next time. Thanks again. Bye.
Bye-bye.